If you ask your neighbor about their health insurance and they're on Medicare, they swear by their plan. If you turn on the commercial on TV, a celebrity's telling you, they swear that this plan is amazing and you're gonna pay $0 and you're gonna get all this money. When it comes to choosing between these two roads, the choice is extremely overwhelming. Forget the brochures for a second. The decision can be made by a simple financial question. Do you want to pay now or do you want to pay later? My name is Sebastian Correa. I'm a local licensed insurance broker in Ocala and The Villages, Florida. And today we're going to talk about the differences between a Medicare Advantage and the Medicare Supplement by the pay now or pay later analogy. So in this analogy for the pay now or pay later, we're looking at Medicare Advantage and Medicare Supplement comparisons. So think of Medicare Supplement as you are paying now. You are paying up front before you even get your medical care. Versus a Medicare Advantage, hey, I'll pay that later. Think of it more of like you're getting a bill in the mail and you'll pay it as you go. And to understand which option really is the right one for you, well, let's do the math and figure that out. So on this side, you have Medicare Supplements. And what you're doing is you're paying up front. A lot of my clients, what I tell them is, are you comfortable paying an exorbitant amount for healthcare now, more than you should pay for, knowing that it's going to be really good for you in the future? And that is truly a really good idea if this option of paying now is better. You see, you're paying for peace of mind. You're paying for the services rendered, and you don't have to pay when you go see the doctor. So let's explain the numbers really quickly, and I'll show you if this is the right option. So Medicare Part A and B, as we remember from the last video, covers pretty much a traditional Medicare. You're responsible for that 20% gap that now this supplement plan is going to be helping you with. For that gap, you will remember Medicare Part A, you don't pay anything, so that's $0. Medicare Part B for 2026, that premium is $202.90. And then you have to add your supplement. So in the supplement route, the most popular plans are Plan G and Plan N. Plan G is more cumbersome, and you're gonna have just to pay a Part B deductible, which for 2026 is $283. With Plan N, covers as well as Part G. The difference is you will have copays. And so the average between any of these two plans, these are the most popular supplement plans, is between $167 to $256 on top of your Part B premium. Now this is for Florida. Nationwide, it might be a little lower. And don't forget, you also have to get Part D, which is a prescription drug plan. That could range from $0 up to $100. So if we're doing the math here, going back to paying now, you'll be paying $202.90 for that Part B premium. For the supplement plan, let's just make it an even $200 on top of that Part B premium. And for simple math, let's just make that this Part D is going to be an additional $50. For your Medicare full coverage, Part A, B, and supplemental, as well as your Part D, you're looking at an expected cost of about $252.90. And that is for Florida. I'm sure some other states might differ. But keep in mind, you are paying for peace of mind. Think of it as an all-inclusive resort. You can go to the buffet table, eat whatever you like, drink whatever you like. It's already been paid for when you paid before you got there. It's the same exact scenario when it comes to this pay now or the supplement route. In the supplement route, you will have the option to see any doctors all over the United States. So now let's talk about pay later or the Advantage route. With Medicare Advantage, there is a zero premium when it comes to your health care on top of that Part B. So Medicare Part B, again, that number is $202 or $202.90. And now if you add a Medicare Advantage plan, you're not paying, many plans here in Florida, you're not paying a single dollar extra. What's unique about these plans is that you also include a Part D. So you're also not paying additional for that Part D. However, you are not paying now But every time you go see the doctor, just like your traditional insurance before you get Medicare, you will have deductibles, co-pays, co-insurance that you'll be responsible. You pay those as you go. So the trade-off here, as you pay as you go, you don't have to worry about a payment now. But when you do see a specialist doctor, you will have a copay. When you go get labs done, you will have a copay. When you go to the doctor, to the hospital, you might have some additional bills that you pay as you go. So the analogy here on the pay as you go, think of it as dining as a la carte. If you're gonna eat a very minimal meal or just even an appetizer, you're not paying that much. But if you're gonna be paying the most expensive thing on the menu, plus desserts, plus a couple drinks, you're now paying more. Really depends on how much you're willing to spend. Now, what's important to also know is that when you are paying as you go, what's really good about this route is that there is a cap. There's something called a maximum out of pocket. And what these Medicare Advantage plans do is they have a maximum out that you can spend in a year for your medical services. Once you reach that max, you don't have to pay anymore. In 2026, Medicare Advantage plans in Florida range anywhere between $2,400. I've seen some be even as low as $500. Again, you might have to pay more as you go, but I've also seen some of the PPO plans go above $7,000 on that maximum out of pocket. Now with these two options, money is not the only way you pay for. You also are paying for control and peace of mind, like I said earlier. With the supplement route or the pay now method, you have access to all doctors that take Medicare. You can go to any facility in the United States, even Puerto Rico, and say, do you take Medicare? And they will open their doors to you. If you go the Advantage route or pay as you go, you will have the distinct issue of having networks like you typically do before you had traditional insurance. And in these networks, they're limited to certain doctors. Well, you might not be able to see a doctor you want because they're not in network. Another important factor to consider as pay as you go is you will have to go through sometimes what's considered pre-authorizations or referrals. If you're not familiar with that, is when you have to see a specialist and your primary care doctor has to refer you to a specialist. Also, if you are needing a prescription, you might need an authorization to get that prescription. It's a little bit more control that when you go the pay-as-you-go method. So let's recap. We've talked about these two different methods. We've talked about how they're different. Which one, again, is right for you? So this is another philosophy that's pretty good. Think of it as if you're a planner. If you're a planner and you hate surprise bills and you also travel often, consider the supplement route or pay the bill now. You're not gonna have surprise bills, and in case you do need it, you've already been planning for that rainy day. Now think of the option as the pay-as-you-go as a saver. You wanna save money, you're gonna save that money, and probably in the next 10, 20 years, when you do have something, you've prepared yourself with saved money for when you do actually need it. Also, if you're a saver, you don't really move out of the city so often. You see your local doctors. Anytime you have any procedures, you try to stick within the networks and you plan for those things. That might not be a bad option to stay on the pay-as-you-go or the Advantage route. Neither option is wrong. I am completely unbiased to either option because I've seen many clients where one fits better than the other. It really depends on your lifestyle, and it also depends on which way you like to pay for your health needs. Now, a question I do get often is, can you switch back and forth? And the answer is, you have a limited time to figure that out. You see, when you're first turning 65, you have 9 months. If you wanted to do a Medicare Advantage plan or a pay later scenario, you have 9 months to make the decision to switch back to a supplement plan. If you decide to do this much later, you can still get a supplement plan, but you have to go through underwriting and the insurance company may deny you for your health concerns. Another important tip, if you get into a supplement route and you're in a supplement for over 10 years, and you now want to test the waters with an Advantage route, same rule applies. You have 9 months to make the decision if you're going to stick with the Advantage route or go back to what you've been paying and avoid any type of underwriting for your health needs. So hope the analogy of the pay now, pay later makes sense to see if a Medicare supplement plan or a Medicare Advantage plan is the right fit for you. But don't forget, you do have to make a decision and you do have to make it quickly to avoid any penalties. Check out the next video to learn more.